Okay, I think we're all ready to get going. Welcome, everyone. Thanks so much for joining us this afternoon or evening or morning, depending on where you are. We are here to talk about the Master of Healthcare Innovation degree, or the MHCI, which is the first fully online degree program here at the University of Pennsylvania. But first, I'll introduce myself. My name is Catherine Rodella. I'm the program manager of the MHCI, which means that I work on the administrative side of the program. Really, the biggest part of my job is supporting students all the way from when they're just inquiring and applying to the program, all the way through to alumnihood for them after graduation. And I'm the first point of contact for both applicants and students. So whenever you email or call to ask a question about the program, I'm the person that you'll talk to. I also want to introduce Adam Zolkover, who's on the call and will be showing us a little bit later what one of our classes looks like. Adam, would you mind introducing yourself briefly?
Sure. My name is Adam. I am the Associate Director for Online Instructional Design, which means that I work with faculty to help translate their expertise into effective online classes. And I also work with TAs and the course teams to make sure that the experience of course delivery is smooth for them and for you.
Right, thanks. Here's a look at what we'll be talking about today. We'll get a nice overview of the program, get into some specifics about the curriculum. We'll hear from current students about what the experience is like. We'll get a chance to look at one of the online courses and see what kind of activities you'll be doing in them. And we'll review tuition, a couple of certificate options, admissions requirements, and finally, again, at the end, there will be a dedicated time for Q&A, but if you have questions throughout, go ahead and type them in the chat box. The Master of Healthcare Innovation, or the MHCI, is a master's degree conferred by the University of Pennsylvania. It was designed from the beginning to be an online degree using the best and most effective online learning practices. So this degree has always been online. This is not a pandemic era change that we've made. The degree is housed in the Department of Medical Ethics and Health Policy, which is in the Perelman School of Medicine here at Penn. Overall, the degree is designed to help you improve healthcare delivery and to adapt to the rapidly changing healthcare landscape. So these are skills that are really essential for healthcare professionals, maybe now more than ever. It'll help you answer questions like, how can you shape policy? How do you influence patient and provider behavior? How can you identify inefficiencies or test solutions through rapid iteration? So these are topics that aren't specifically covered in, say, med school or nursing or business school, and this is part of what sets the MHCI apart. What will students actually do in the program? First, you'll build a network of innovative healthcare professionals and resources. This is a cohort-based program, so your fellow students will become your resource network. Students are professionals from a huge variety of different parts of the healthcare system, and so they really do learn a ton from each other. Second, you'll develop skills for designing systemic solutions to problems in healthcare delivery. This isn't a research degree. It's meant to be a practitioner's degree. You will practice skills and you'll practice tools that you can apply immediately in your work. And these skills will also inform the way that you approach your future roles in healthcare as well. And third, you'll get a chance to actually apply these concepts that you learn in practice-based innovation lab courses. So by the end of the degree, you'll be fully equipped and ready to implement an innovation project in the real world. So to be a little more specific about what the curriculum covers, this is a degree in innovation, as it says in the name, but innovation, of course, can mean a lot of different things in different contexts. So what does it mean in the context of this degree? Innovation in the MHCI is a methodology. It's a way of identifying problems and solving problems in healthcare at all different levels of the healthcare system. So the degree is meant to give you the tools to accomplish this. It focuses on two main competency areas. So you'll primarily work on skills in innovation and skills in leadership. Innovation skills might include things like idea generation or complex problem solving. Leadership skills could include things like communicating your ideas, networking, and persuasion. And it's this unique combination and focus on innovation and leadership that helps sets the MHCI apart from different degrees. So what makes it a little bit different than from, say, an MBA or something like an MHA. And just like the field of innovation itself, the MHCI is a really interdisciplinary degree. Many of our teaching faculty come from our Department of Medical Ethics and Health Policy. Many of them come from the School of Medicine, where the program resides. But there are also faculty in the program who come from Wharton Business School, from Penn Law, the Penn Medicine Center for Healthcare Innovation, Penn Nursing and Design. And these faculty are all world-renowned experts in the degrees for primary topic areas or subject areas. These are health policy, behavioral economics, operations management, and innovation methodologies. Our faculty members, for example, Dr. Zeke Emanuel and Dr. Kevin Volp, they're all very active in their fields. They're influential decision makers and researchers in their fields at the national and international level. So you get the advantage of getting access to their expertise, and you'll have the opportunity to interact with them in weekly live sessions. And this pretty distinct combination of faculty expertise and the level of faculty quality is not found in other degree programs. So again, by gaining foundations in these four areas, you're going to be able to identify problems and solve problems that you're facing in your work. Okay, now on this side, we can get into a little bit more detail about the curriculum and what classes students will take. This is a bird's eye view of the curriculum. You can see listed here all of the classes that students take. And this is what the course schedule looks like on the 20-month track. There's also a 3-year option available for students who might want to spread the workload out or maybe spread out the financial commitment over a longer period of time. So you can choose 20 months or 3 years. Either way, you're taking these same exact classes and you'll have the same degree requirements. Really, the only difference is that on the 3-year track, there's usually more time in between classes, while the 20-month track is a little bit more fast-paced. Every school year kicks off with the virtual MHCI seminar. You can see that across the top in green. And that's a virtual event with orientation activities, educational activities, social activities that help get you ready for the school year. And I'll get into more detail about that event specifically in a little bit. After you attend the virtual seminar in late August, then you are off and running with your online courses for the rest of the school year. And I want to point out that the schedule for the MHCI is a little bit unique in that these classes are intensive and they're on a condensed schedule. So you're taking one class at a time. Classes typically are 6 weeks long or 4 weeks long. Most of them are 6 weeks long. And on the 20-month track, usually there's 1 week off in between classes. So you get into this rhythm of 6 weeks in a class, a week off, back to another 6-week class. Again, on the 3-year track, there often will be more time off in between those 6-week classes. You can see the blue classes listed here are the core classes. They'll deal with those 4 main subject areas we talked about: health policy, behavioral economics, operations management, and innovation. And students also take 4 lab courses. Those are the yellow courses you see here. Lab courses are a little bit different in that they are 4 weeks long, and each one of them is associated with a core course. So in a lab course, you are practicing applying concepts that you've learned in a core course. So to give an example, if you look at that second semester where the lab is applying behavioral economics, right before that lab, you've just taken the core course, Behavioral Economics and Decision Making. You've learned about different behavioral economic strategies. And then in the lab, you might get a case study to analyze where you develop and propose a specific behavioral economics intervention for that case. So the labs are very project-based and independent work-based. And finally, students get to take 2 electives. Those are the pink courses you see there. Electives work very much like core courses. They're 6 weeks long. And in the electives, you'll have a selection of topics that you can choose from based on your own interests. I also want to point out, in the final semester of the program, so if you look at that final spring semester under year 2 for the 20-month track, there is another event listed there in green, Innovation Weekend. Innovation Weekend is an event that students will attend in their final semester of the program. It's an in-person event on Penn's campus, and it's meant to prepare you for life after the MHCI. So it'll be very focused on networking and idea sharing, and I'll talk about that in more detail in a minute. But this is what the curriculum looks like. Any questions about the curriculum so far, you can go ahead and type those in the chat box. Jeffrey asks, are courses taken for grades? Yes, so core courses and electives are taken for letter grades. Lab courses are pass-fail to give you a little more buffer to be able to experiment. Are there additional costs to attend the live weekend? I'll explain that in more detail in a couple of slides. Jennifer asks, do you find most people are able to work full-time while doing this coursework? Yes, these courses are designed specifically for full-time working professionals. In fact, I think all of our students are working full-time. So again, the 4 lab courses are meant to help you gain a deeper understanding of the concepts that you learn in core courses by putting them to practice. In the first 2 labs, Behavioral Economics and Operations Management, you're really working on skills where you learn how to get your ideas out into the world. So if we go back for a second, those 2 labs are the ones that you will take earlier during your time in the degree. The final 2 labs that you take, Pitching Innovation and Building a Case for Transformation, in those labs, you're actually drawing on your work experience, and you're going to be asked to develop a project idea. So by the end of the degree, through these labs, you will have a fully developed project proposal in hand that you're ready to implement in the real world. You'll have a chance to take 2 electives while you're in the degree. This is a list of the topics that are being offered to students this year. Elective offerings might change from year to year, but this gives you a good idea of the types of topics that you might see there. And again, just like the core courses, electives are taken in 6-week blocks. All right, now a bit more about those 2 student events that I know some of you had questions about. Students will attend 2 types of events while they're in the degree. The first is the virtual seminar. Seminar is a virtual 4-day event that students attend every year to kick off the school year. It's always in late August. This year, it's tentatively scheduled for August 22 to 25. And it's focused on getting you ready for the school year. You'll get to know your classmates and the faculty members and start building those relationships. There are different orientation activities. You'll learn how to use all the online learning tools and how to navigate the online courses. So before you even have to take a course, you'll have plenty of practice and you'll be a pro and how to use all those tools. And you'll also get to attend engaging panels by healthcare innovation experts. So it's not just orientation, there's also a big social component and an educational component. The 4 days are pretty busy, they're pretty intense, but we find it's kind of like summer camp. Everybody has a lot of fun and they get to build bonds pretty quickly over that relatively short amount of time. Innovation Weekend is an in-person event that students will attend in their final year of the program. So this will be, again, in person on Penn's campus in Philadelphia. And the goal of Innovation Weekend is to start getting you ready for life after the MHCI. So the focus is on networking and idea sharing. Students will get an opportunity to pitch ideas and projects and get feedback on it. You'll attend different networking activities and career development sessions. And you'll also get a chance to network with the alumni who are invited to come back for one of the days of the weekend. Of course, any plans for in-person events are subject to, whatever public health measures are at the time, but we're expecting and hoping that by February of 2022 that shouldn't be a problem. I know somebody had asked about additional costs for the in-person weekend. The only additional cost for students is their travel to and from Philadelphia. Hotel rooms will be made available for students who are out of town who can opt into that. But everything else for those activities is covered. Okay, let's see if anybody has questions about these events. Are lab courses group work or individual projects? It is mostly independent work, but students very, very often are asked to give feedback on other students' work. Do you have to choose the 20-month or 3-year program when applying? Can you switch from one or the other? You do choose one when you start the degree, but the option is there to switch if your circumstances change. We have that happen once in a while with students. How big is the class? We expect the next incoming cohort to be somewhere around 45 students. Right, and who are MHCI students? I mentioned a couple of times that they come from a huge variety of different backgrounds in healthcare, but what they all have in common is that they are mid-career healthcare professionals, and they all aspire to improve the way that healthcare is delivered. Right now, we have 81 current students across 2 cohorts in the degree. The students have an average of 13 years of experience in healthcare, but there's a big range there. We have students who are earlier in their career who have a minimum of 3 years of experience, and we have students who have over 25 years of experience in their field. They come from all over the U.S. and a few from abroad. And you can see here some examples of roles and healthcare sectors that students have come from to give you a sense of the variety there. So there's a good mix of clinicians and non-clinicians. We get students who are C-suite executives, physicians and nurses, researchers, managers and administrators, consultants, data scientists, entrepreneurs, and they come from all different parts of the healthcare system, hospitals and health systems, private practice, pharmaceutical companies, insurance companies, startups, government agencies, health IT. And this kind of variety is a goal and one of the pieces of value of the degree, because students get to learn a ton from each other and get exposed to different perspectives and experiences across healthcare that they might not, in their siloed sector of healthcare that they work in. And keep in mind, this is not an exhaustive list of the types of backgrounds that students can have. There are all kinds of different healthcare professionals who aren't represented here who could still be a good fit for the program. If your professional experience is not directly in healthcare, but maybe related to healthcare, you're definitely still welcome to apply. I would encourage you to, in your personal statement, make a very clear case for how your experience will translate into an impactful career in healthcare. And again, since our students come from so many different backgrounds, they all have many different reasons why they decide to do this degree, but those reasons tend to fall into 3 main buckets. First, there are students who just want to improve the work that they're doing in their current role. Some students are taking on a new role. For example, maybe they're taking on a more leadership role or a role that's more specifically in the innovation world, and they want to have the skills to be able to be successful in that role. And finally, we have students who are not currently in a leadership or an innovation specific role, but they aspire to one more like that in the future, and they want to have the skills to make them appealing to employers who are looking for applicants like that. Well, I'm very excited that we have two of our current students on the call today who are kind enough to make time out of their busy, crazy schedules and take a break from homework to talk to us a bit about their experience in the program. So James and Pat, if you could go ahead and unmute yourselves and your videos. James Donahue is the Clinical Innovation Operations Lead at Regeneron Pharmaceuticals, which is in Tarrytown, New York. James is in his first year in the MHCI, so just started this past August. Patrick Kim is a trauma surgeon here at the University of Pennsylvania and Penn Presbyterian Medical Center here in Philadelphia. Pat is a second-year student, almost done with the program, and will be graduating in May.
Hopefully.
Hopefully. So let me stop sharing my screen so that we can see the two of you. Thank you again for being here. And first, I'd just like you both to introduce yourselves and talk a little bit about what you do. So James, could you start?
Sure. So a clinical innovation operations lead at Regeneron, which means I support new and ongoing clinical trials and the development and deployment of different sensors and wearables to help understand treatment effect, disease progression, disease prediction, and things like that. I've been in the pharmaceutical industry for about 12 years now in all different aspects, and recently, last year, switched over to the clinical side. Yeah.
Thanks. All right, Pat, how about you?
Hi, Catherine and Adam and everybody. Thanks for having me. I am a trauma surgeon. As Catherine said, my practice also includes surgical critical care and emergency general surgery. A lot of my practice is at Penn Presbyterian Medical Center. I also practice at the Hospital University of Pennsylvania. And my practice is pretty evenly split between those three areas. And being at an academic medical center, we're responsible for teaching every level of medical trainee and other types of providers, and doing research, and I have a growing amount of administrative responsibilities as well. I can't believe I'm saying this, but I've been an attending surgeon for 16 years, and you know, I guess that would be mid-career, and I've really enjoyed the MHCI program so far.
Great. The first question I wanted to ask of both of you is, and I'll start with James again, why did you decide to pursue an MHCI?
Yeah, it's a really great question. And since I graduated from undergraduate, I didn't pursue any advanced degree, and I always wanted to. But I knew that I wanted it to be in innovation space. So after a lot of extensive research and toggling with the idea of just doing an MBA. I'm not a care provider, so nothing too scientific for me. I came across this program, and after kind of attending info sessions and understanding what topics were covered and classes there were, it really made a lot of sense and aligned with somebody who works in innovation that's supposed to be developing different things that help patients, and supposed to kind of be a transformative pillar of an organization where you need to work with different stakeholders and sometimes sell different ideas. It really just fit perfectly, and it's working out that way so far.
Glad to hear that. Pat, why did you decide to pursue the MHCI?
Well, it certainly wasn't part of my plan when I started practicing for a variety of reasons. And I think what I realized after several years was that my professional career, my personal life, and my organizational life is very difficult to predict, but I really enjoy learning, and I really enjoy being able to take advantage of opportunities and challenges. and a program like this was, I mean, as close to perfect as I could imagine. Really learning a lot about different fields that I wasn't exposed to formally, and being able to use some of these skills in the future. So I'm not one of these people who have, a clear plan of what to do with the degree in hand, and at the same time, I'll say that, I feel like these skills and the knowledge that I'm getting are going to be useful in the future, wherever the organization needs me to do it, or wherever I feel like I need to go professionally or personally.
Yeah, thank you. So the next question is a question that I get a lot, and I think a few people had even put in the chat already. But with all of our students working full time and having such busy schedules outside of school, how do you balance school with work and whatever other, personal responsibilities and commitments you have in your life? James, you want to start?
Yeah, I mean, this question was certainly a concern of mine. Last year I was new to Regeneron Pharmaceuticals, and the first clinical trial that I was ever assigned to work on was the COVID trials, where, basically day and night was just dedicated to getting these up and running at warp speed. And it was certainly a concern, and I think what I realized is, and I don't mean for this to come off cheesy, it doesn't really feel like you're doing work. I dedicate certain days of the week where I'll do certain things. If I'm going to do the modules, if I have readings, we were given some really fantastic books for the first couple of courses to read. I think when you have sort of that passion or that interest or experience in the industry, in whatever aspect it may be, it really didn't feel like I was studying. It didn't feel like I was, really needed to, concentrate necessarily. And it felt like I wasn't really enjoying what I was doing. The time commitment, I think, is really accurate for what you share with everybody. But when you're looking at spreading it over the course of the week, and the fact that the TAs are extremely helpful, if there's extenuating circumstances and you need an extension on something, they're really accommodating about that. But overall, I think it's accurate. It was easier to manage than I thought it was going to be, basically.
Good. Yeah, and I'm not sure if I mentioned the exact time commitment already, but it's about 13 to 15
hmm
hours per week that students find.
Yeah, and I think that's pretty accurate. And if you dedicate, an hour or two a day, whether it be in the morning, I know a lot of folks in the cohort spend some mornings where they'll do it before everybody in their house gets up. They'll get some reading done. For me, I'm more of a night owl, so I'll spend an hour or two, doing some readings, and then a little time on the weekends as well. But it hasn't been overwhelming.
Good. Glad to hear that. Pat, anything you'd want to add to that about balancing school with the rest of your commitments?
No, I would agree with you and James that the time commitment sounds about right. I don't use a stopwatch to, say when I'm actually doing work for the program and when I'm not. But I will say then that for me, I mean, the truth is in my schedule, there are weeks where I'm really busy, and then either weeks or days, and then there are other weeks where I'm not as busy. And I think that if I know my schedule for the next several weeks, and then I look at the schedule for the program, I have a good sense about what it's going to look like, and I try to really allocate my time appropriately that way. I'm not really the kind of person who commits, some amount of time every single day, but I think that it can be done. If you read, if you look at really what the assignments are, what the workload is going to be, I just try to fit it in. And I do think that it's important to know that a lot of the classes are discussion based. When you respond to a question or an assignment, and that's due by a certain date, and then you usually have to also respond to someone else's post, which increases your commitment and focus and concentration on what's on the material. And so I would say then that because most of the program is asynchronous, you can you're still being carried along on a time schedule, but you can commit sort of when you can, and then the parts that's synchronous, where you have classes together, is not very burdensome. It's quite manageable. And I would also agree with James that a lot of it is quite fun, very interesting, and again, for me, a lot of the content is stuff I wanted to learn anyway, and just having it be more formal really helps me. And what I also wanted to say was, before I committed to it, I actually spoke to some of the physicians in our health system who had preceded me in the program, and asked them about the time commitment and how they found the workload and so forth. So based on that, I felt okay committing to it.
Great. So James, I know you only have one full semester under your belt. This is your second semester, but so far, have you seen any impact on your work from what you've learned in the program?
Oh, absolutely. I think, the first course right off the bat, where you review kind of the American healthcare system, and you dive into this amazingly complex space that, being on the manufacturer side of the system, we've only seen a little bit, and you try to grasp it to understand things like pricing and insurance, and kind of going through that course is truly mind-blowing, to be honest. And it really helps you kind of understand that space in great detail, which in my line of work is really important, because when we're looking at deploying technology, for example, into trials, the ultimate output is being able to prove outcomes and how outcomes impact things like insurance or coverage or patient demand and things like that. So it has certainly made a big impact when we're trying to do some of our strategic planning.
Great, thank you. So Pat, I know you said you don't have your clear plan yet of what you're going to do with it afterwards, but what kind of impact have you seen so far on your work from what you've learned?
Well, I think that I am always impressed with the number of new ways that I can see a problem. And before, I would say I was much more one-dimensional in approaching a problem. There would be a problem, and I would complain about it, and it would be frustrating because I had a very simplistic idea of what the problem was and how it should be solved. And I think that really, through the cumulative effect of all the courses, there are so many more ways to look at a problem, think about it, and address it. There's so many more lenses to view things with, and I would say that, the problems that I think about have to do with patient care, have to do with influencing peers, have to do with systemic problems, and so I think that it's really given me. I can put on more hats when I think about a problem. I can say, oh, well, here's a bottleneck in a flow problem, and I can name the steps where there could be potential solutions, whereas I couldn't do that before. I can think about I can name the ways that people don't act the way that I think that they should, and think those things through a little bit more carefully, and hopefully more successfully. So I would say then that it's a lot of fun because you can see the world in more ways than you did before, and think about ways that you might be more effective rather than usual. I'm a surgeon, so it's just like, I want things to be a certain way. I demand them, and that is surprisingly ineffective in the real world. So I think that that's one of the ways that the program, I use the program in everyday life.
Really great to hear. Thank you. Just one more question for the two of you, and then I'll let you go. James, in your, just the few months that you've been in the program so far, I'd like to hear a little bit about the interpersonal experience. So have you built any kind of network, and what kind of relationships have you built so far?
Yeah, absolutely. And I think, some of the cohorts before us do the same thing as well, but our cohort decided to use Slack, for those that are familiar, to be our primary communication tool. And it goes off all the time, but in a good way. And we'll have robust discussions about assignments if somebody's confused about something. Like Catherine said earlier, there's so many folks from different walks of life and different backgrounds in the program. and there's always somebody who's willing to explain things in a different way, which has been really helpful throughout. We have different channels where, like, we have one that's dedicated to homework assignments, we have one that's about schedules, and then there's one that's about fun. I think so far, and then Catherine, I don't know if you know this, I think we've had 3 or 4 happy hours so far where we'll just get on and talk about different topics. Sometimes we'll talk about some things from class, talk about different lectures. Sometimes we'll just talk about life. There was one on Halloween, one around the holidays, and I believe there's one brewing as well. So in terms of being able to network, I think having these like-minded people from all different backgrounds has been probably one of the greatest parts of this, and how much you learn from them. Like Patrick was saying, being able to apply and think differently, I think that the people that are enrolled in the program have a big impact on that.
I did not know about the happy hours, but I'm really happy to
Yeah.
hear about that. That's awesome.
Every few weeks, there's a little happy hour where everybody will get together and just like an hour or so. But it's been pretty fun.
Yeah, that's really great.
Yeah.
Pat, so as you know, you're nearing the end of your time in the degree. Can you talk a little bit about the kind of network that you've built?
Yeah, it's really amazing. I think that the program follows through with encouraging the diversity of people that work in healthcare fields and the backgrounds and geography, and it's been really remarkable. I've really enjoyed all the interactions I've had with my classmates so far, and it's really true that there is so much that I'm learning just from I mean, all the kinds of learning that we're doing, the written posts, the synchronous classes, interactions. We're also on Slack, like James said, and it's been really rich, in terms of like the experiences that people have and the perspectives. And I do feel confident that going forward, if I have a question about something, I can tap somebody and just say, what's up with this? And anyone, I think, will feel comfortable doing the same with me. I think we've got a great class. I think that one of the things that people might be concerned about is like, how safe is it? Can you really go and look like an idiot? And if you're learning something that, and you might feel lost or something like that. And I can absolutely guarantee that this has just been such a great group of students. Everybody's very supportive, and we help each other out. And I feel like I think it's pretty safe to say that people feel pretty good about learning in our environment.
Yeah, it's
Yeah, I mean, it's.
definitely, Patrick, a safe zone. Sorry, Catherine.
Oh,
It's
go ahead.
there's no silly questions. And the fact that we have folks from so many different areas has been amazing, especially if you have questions about the insurance industry. I know we have some of those folks, doctors getting feedback from folks like you, Patrick, and others has been really phenomenal.
Yeah, and that's innovation. Everybody's trying stuff out, trying new things.
Hmm.
Some people will be an expert in one area where other students have no idea about that area. So and sometimes you try stuff and you fail, and that's okay. And that's part of what
Yeah.
innovation is. Well, thank you, James and Pat. I really appreciate you taking the time out to do this. I know you're both super busy right now. In the interest of time, to make sure we have some Q&A at the end, I'm going to move on to the next slide. But if you have questions for James and Pat, they're going to stick around and they'll be here for the Q&A at the end. So you heard James and Pat allude to some pieces of the online course experience. The important things to know about these classes are that they're flexible, they're designed for full-time working professionals. So there are deadlines for assignments, but the content is available on demand and is mostly asynchronous so that you can log in and work on assignments whenever your schedule allows. Again, the time commitment is around 13 to 15 hours per week while you're in a course. And you'll be taking one at a time those 6-week classes, core or elective classes, or 4-week labs. The courses are all online on a platform called Canvas, which some of you might be familiar with. If you've never used it before or heard of it, that's totally okay too. And in the class on Canvas, you'll find 3 different types of content. The first kind of content is media, so things like engaging lecture videos by the faculty member or interviews with special guests. Very often there are readings to provide context and further resources. Often those will be things like PDF articles that are provided to you. You'll find interactive content, things like the discussions that were mentioned, where you interact with other students and maybe respond to a prompt. There are weekly interaction sessions with the faculty member. Very often that'll be a live synchronous class once a week. And finally, there are assessments, things to see how well you're learning the material. So you might run into things like quizzes. There are, of course, different assignments. And then every class has some kind of final project or paper. So no exams, no midterm or final exams. It's more project focused. And now I'd like to turn it off to Adam for a couple of minutes, who's actually going to show us what one of these courses looks like on Canvas and some of the things you'll encounter.
Great. So what I'm showing you here is one of our upcoming classes. It's Leading Change in Healthcare, and it's taught by Zeke Emanuel and Jennifer Myers. And what I want to show you in this course, and this is true of all of our courses, is the way that our course content is, 1, supported, 2, predictable, and 3, social. So it's supported in this sense. If you see at the top here, we have contact information for a whole host of people, for the faculty, for the course TAs, and for technical support for the class. And there are humans on the other side of all of those emails. Our goal is really to facilitate your learning and to not let the technology get in the way of learning the actual content. You shouldn't have to learn in order to learn is really our sort of main philosophy on this. The second thing that I wanted to show you in classes is the way that courses are predictable. So coming down here, and sorry about the scrolling there, you can see topics and key dates on the front page of the course. So topics and key dates are really important. It's important that you see this at the beginning of a course, that you take notes, that you put it in your calendar, and you get this right up front at the beginning as soon as you log into a course. But in addition to that, you also get reminders, you get it in a few places, and the most important thing is that all of this is consistent across courses. So with some exceptions for things like holidays, almost everything in courses are due on Sundays or Tuesdays, which means that not just within a course, but across courses, you'll be able to plan your time. The next thing that I wanted to show you, scrolling all the way down the page here, is this big red Start Here button. And clicking on Start Here takes you to the modules page for the course. Now, this is really the big outline for what's in all of our courses. And you can see right here, starting with week 1 of this course, you have an overview, you have some material to watch, you have a bunch of material to read, and then you have a bunch of practice assignments, discussions, etc. And this is where the social part comes in. Almost all of our assignments are meant to be social from the get-go. So I'm going to show you right here, we have a discussion. Discussions are one of the key assignments that you'll do in most weeks of courses. And what they ask you to do is to post your thoughts on a topic and then respond to your peers on a topic. So you're getting to know your peers even as you're practicing the material. And your peers are holding you accountable for actually knowing the material because they're responding to you and they're filling in the gaps and showing you where to review. The other piece that I wanted to mention here, because somebody had asked a question about it earlier, is the synchronous classes. Most weeks have an hour-long synchronous class where you get to know your classmates and you also get to know the faculty in the class in a live session. And those are usually held at noon or 4 p.m. Eastern time. There's a little bit of variation on that, but I know for folks who are on the West Coast that can be an issue, and we try not to make things too early if you're out of our time zone. The last thing, switching back to the modules page for a minute that I wanted to show you, is we do our best to make sure that courses are relevant every time they run. So there's a lot of material that's really evergreen, that's sort of core ideas in healthcare innovation. So in this case, it is some case studies in practice transformation, things like that. But there's also the material that changes from run to run so that we are sure that you're getting an experience that is relevant to healthcare at this moment and to society at this moment. And in this class, what you'd find is that we've recorded some new video material that's specifically about COVID. We've created some new assignments that are also about COVID. We've updated the readings, and we have also updated the assignments and a bunch of the materials throughout the course to make sure that we are on task with the new urgency that we've seen throughout 2020 and now 2021 around health equity and around making sure that vulnerable and marginalized people aren't overlooked in the healthcare system. So that is a course in a nutshell. And with that, I'm going to stop sharing and turn it back over to Catherine.
And just to reiterate what Adam said, the important things to remember about these courses is that they're flexible and that you'll be well supported. There's a team of actual humans here whose job it is to help you succeed, so you won't be off floundering alone trying to figure these courses out. We've got about 10 minutes left, and to make sure we do leave time for questions, I'm going to quickly, but hopefully not too quickly, go through tuition and then the admissions requirements. The total cost of the degree is roughly $64,000. That's all tuition and fees, everything included, around $64,000. Students are billed according to the number of credits that they register for each semester. The way Penn counts course credits is they use something called a course unit, or CU. One course unit is one typical course, so what might be equivalent to like a 3 or 4 credit course at another university. Core courses and electives are all one course unit. Labs are a half course unit. So students take a total of 11 course units throughout the degree. In the upcoming academic year, one course unit will cost $5,798. You can see in the table on the right how the course units are distributed by semester in the 20-month track. So it's pretty evenly distributed. You'd be taking 2.5 or 2 course units each semester. There's a little more variety per semester on the 3-year track, depending on how you set up your schedule. There are a few different ways that students pay for the program. Some students are self-funded. We get a number of students who get tuition assistance through their employers, and some students choose to pursue financial aid through federal loans. So if you have any further questions specifically about paying for the degree, I welcome you to email me, and we can talk about what it would mean for your individual circumstance. Before we wrap up, I do want to point out there are a couple of certificate options if you decide that maybe doing a full degree right now isn't the right choice for you. There's a graduate certificate in which you would have the opportunity of taking up to 4 actual MHCI classes that could be transferred into the degree if you applied at a later point. And there's also a professional development option where you can take non-credit classes in different innovation topics. So if you're interested in any of those, feel free to contact me, or you can learn more about them on our website, improvinghealthcare.net. And finally, if you decide that you want to apply to the degree, there is a deadline coming up on February 12th. That's the early application deadline. There's also a final application deadline of May 1st. Either way, the program will start in August of 2021. It's not rolling admissions. If you apply before February 12th, anytime before February 12th, your application will be reviewed starting February 12th, and then you'll get your decision a few weeks later in mid-March. If you apply anytime between then and May 1st, you'll be reviewed starting on May 1st, and you'll get a decision by the end of May. In order to be eligible to apply, you have to have a bachelor's degree and at least 3 years of professional experience in healthcare or a related field. And you'll need to fill out and submit an online application that's on our website at improvinghealthcare.net. In the online application, you'll be asked to provide a personal statement, a current CV or resume, and contact information for 2 recommenders. To give you a heads up, once you put your recommender's contact information in the application and save it, even before you submit it, those recommenders will get an automated email from our application system with a link to the recommendation form. So just give them a heads up before you put them in there so that they're expecting the email and know what it is. And then the last piece of the application, which happens outside of the online application, is we require official transcripts from your previous schools. So any school where you've gotten a higher education degree or completed a significant amount of coursework, we'd like to see an official transcript for that. Please have them send electronic versions if possible. We're still working remotely, so don't have access to things that are sent to campus. Though if for some reason your previous school only can do hard copy transcripts, just contact me and we'll work something out. There are no standardized tests required, I should mention that, and there's no application fee. So thanks, that's the end of the formal presentation. Again, the upcoming early deadline is February 12th. You can find the online application at improvinghealthcare.net. And my email address and phone number are on the screen, so feel free to contact me outside of the session if you have any individual questions. And for the rest of the time, I know we have only 5 minutes scheduled for questions until 5 o'clock, but I'm happy to stay and keep answering questions as long as you have them. I wanted to go back to a question that Jeffrey had asked a few minutes ago. Jeffrey said, please comment on the diversity of the faculty and students. To what degree does course content directly address health equity, justice, and vulnerable populations? There is an elective course on health disparities and health equity. And then in light of all of the protests from this summer, we've taken a pretty hard look at our curriculum and have looked closely at each class at authors that are represented, case studies that are used in the course, readings and topics to make sure that health equity and diversity are really well reflected in every course, in every part of the course. It's great to have an elective that's specifically about it, but equity is not a separate standalone thing. It's an important part of all of healthcare. So we've recently done that review of the curriculum to better integrate it into all of the pieces of the courses. And Adam, I know you worked a lot more closely on that than I did. So if there's anything else I missed or you'd like to add, feel free.
No, I think that you've captured it pretty well. The only other thing that I would add to that is that our cohorts include students of various ages, of various educational backgrounds, and they also include first-generation college students, people from various ethnic and racial backgrounds. There is actually really genuinely a diversity of students who do come into this program.
Yeah, thanks. That's a good point too. There's a question, is the transcript only required from the most recent school? We'd like to see a transcript from every school that you've gotten a college or university degree from. So say if you have a bachelor's and then a master's, we want to see transcripts from both of those. If you have a PhD or MD, we'd like to see undergrad and the higher degree. We don't require the transcript if, say, it's a school where you just took a couple of classes in the summer, if it's not something relevant to this degree or not very relevant to your application. That's okay. We don't need a transcript for that. Oh, and I want to say for the rest of the time, if you want to ask your questions out loud, feel free to unmute yourselves. This can be more of a conversation at this point, but happy to answer questions from the chat too. Michelle asks, when will the next class start? Every year, students start in August, so we only have fall semester starts once a year. You can't start in the spring.
Hey, Catherine.
Yeah. Hello.
Hey, this is Stefan. Thank you for a great presentation. Appreciate it.
Sure.
Um, so for me, it was interesting because one of the Q&As, was something about how one of the current students had selected this program, and he had said that, he kind of gone back and forth as to whether or not to pursue an MBA, or look into this program. So I'm kind of in a similar boat. And I guess my thinking is why this is appealing to me is A, there's, a cost element to it, that's more appealing. But also, I think that in the line of work that I do, and I work in medical devices, a lot of what's taught in an MBA program isn't really applicable to doing what I want to do with my career, or what I want to, pursue even personally outside of my career. And so, but at the same time, I do work for a business, and it is helpful from a career perspective to have business related courses. So, I mean, I know there's some, background that you've sent via, some of the different communications as to the coursework and things like that. But can you just comment on that? Just, just in no, particular realm, but just in general, if you feel like this degree kind of hits on that.
Yeah, sure. And you said it was Stefan, right?
Yes, yeah.
Yeah, this is a question that we get a lot, the MBA versus MHCI question. And we've had several students who have done an MBA and then did an MHCI because they found that there is value in both, but the value is different. They focus on different things. So one of the things that is different about the MHCI is obviously it's going to be a lot more healthcare focused. It's going to help you contextualize your role in the larger healthcare system, which is not something that will be a focus of an MBA. An MBA will definitely be more broadly applied. It'll be more management focused, whereas the MHCI is kind of covers improving healthcare at all different levels of the system. MBA, you probably would get more, finance and economic classes. We do have a core course, health economics, but the finance piece isn't a major focus of the degree. And again, the MHCI is all about leadership and innovation. So it's about learning how to identify problems and learning how to solve problems that are in healthcare. And that's quite a bit different from what you'd be focusing on in an MBA.
That makes sense. Thank you.
Yeah, thank you. It's a good question, and one that I do get a lot. Lila asked, will you accept unofficial transcripts for the February due date if official transcripts are sent prior to the program start date? Yeah, that would be okay. If that's something you need to do, email me and we'll work it out, but that should be fine, as long as we get the official transcript before the program start.
Hi, Catherine. Do you want to add on to the question about cohort start dates from Michelle?
Sure. Each cohort, I think I said this, but maybe I didn't. Each cohort starts in August every year, so it's only a fall semester start. There is not an option to start in the spring. Yeah, we have a question about elaborating more on the certificate program as it pertains to cost and schedule. I'll go back to that slide again so you can take a closer look at it. But there are two different certificate options. One is a graduate certificate. So in the graduate certificate, you'll be taking classes from the MHCI. You can take 4 classes within 2 years, in order to earn that certificate. And again, in the graduate certificate, those are credit-bearing MHCI graduate courses. So they cost the same per course, and it's the same time commitment that you would see in a regular MHCI course, and you're taking the course with MHCI students. The professional development option is different in that they're not MHCI courses. They are professional development courses. So they're still about healthcare innovation topics, but they're not credit bearing, which means that they are not quite, there's not as heavy of a time commitment, and they're less expensive. For the professional development classes, you can take as many as you want a la carte, or you can take 4 within a 1-year period in order to earn a certificate of completion. Those courses are also a little bit shorter. They're 4 weeks long each. I have a question about how many hours a week can we expect to devote to our studies. It's usually 13 to 15 hours per week, and classes are 6 weeks long, except for lab courses, which are 4 weeks long. Robin asks, do you have to apply to the graduate certificate, or can you just register for the classes? You do have to apply. It's a less intensive application process than it is for the MHCI degree, but there is a form to fill out, and we'll review that along with your resume and a short statement. That's what the application process is for that. So Robin asks, do you have the option after the graduate certificate to go on and apply to the MHCI? Yes, definitely. From the graduate certificate, you can apply for the MHCI, and courses that you had taken in the graduate certificate can be transferred into the MHCI degree. And you can apply to the MHCI and transfer from the certificate actually before you've even completed all 4 courses. And again, that's for the graduate certificate only. That's not the case for professional development. Mark says, is there a resume length maximum? Specifically, are we looking for 1 page, and is the resume or CV, does that imply one or the other, or does the board want to see both? There's no maximum. Since our students come from many different types of backgrounds, there are many different resume norms, and there are different industries. So sometimes we see a standard 1-page resume. Sometimes we see, for example, from an academic physician, it might be a many-page long CV. So there's no standard length that we're looking for. Usually students will only upload one or the other, resume or a CV. So whatever you think would best show off your strengths. Indira asks, what is your acceptance rate? I don't have that number off the top of my head. I will say it tends to be a pretty self-selecting group, because this is a degree that people take because they want to do it and because they're very enthusiastic and very committed to innovation. But we're expecting, about 45 students in the upcoming cohort this year. So Ananias is asking, is there an existing place to view profiles of former or current students to better understand their backgrounds? I think we have profiles of a few alumni on the website. We do. I'm going to share that link with you. So that just tells you a little bit about a few of our alumni. There's no specific place to see other student backgrounds, but if you're interested in connecting with any current students and maybe emailing them and asking them questions, I'd be happy to connect you if you want to email me about that. I can look and see if there are students who maybe have a background that's similar to yours. And you had also asked, Anais, does the program attract tech industry professionals as well? Yes, yeah, we do have some people who come from the health tech world, including a couple from digital health startups. All right, I think I've got all the questions. I want to thank everybody again for taking the time out of your day today to attend the session and learn more about the MHCI. I'm always happy to answer more questions outside of the session. Feel free to email me. Thanks, Adam just put up my email address in the chat. And once again, we've recorded this session, so we'll send it to you in a few days. So thank you again, and have a great night, everyone.